So our first panellist is Professor Christina Mitchell, who's the Academic Vice President and Dean, I hope it's in the same order there, yes it is, from the Faculty of Medicine at Monash University. And Chris chaired the Academy's first major policy project as chair of the working group that looked at how Australia can better embed research and innovation in the health system. This was published in October last year. Our second panellist is Professor, well, we'll go with up here, Professor Don Nutbeam, who's the Executive Director of Sydney Health Partners. Don has held numerous leadership positions, including Vice-Chancellor of the University of Southampton, Provost of the University of Sydney, and was Head of Public Health for the UK government under the Blair government, I recall. And so Don chaired the Academy's Health Horizons Forum, which took place on prevention, which took place in July of this year. Our next panellist on the list up there is Professor Maree Teesson, who is the Director of the Matilda Centre at the University of Sydney. She's chair of Australia's Mental Health Think Tank and chair of the Million Minds Mental Health Research Mission Expert Advisory Panel. And Maree chaired the Academy's Health Horizons Forum Roundtable meeting on mental health, which took place in March, and the report of which was published on Tuesday to mark World Mental Health Day. And our final panellist is our incoming president, who we now have seen many times, Professor Louise Baur. Louise is a paediatrician and internationally recognised childhood obesity researcher, also a public health physician, and has done a heap of work around obesity, physical activity, and childhood and adolescence. And as we all know, is our incoming president. So thank you all for coming up to the podium. And the last thing I would say is we have had reports of poor audio. So if people cannot hear our speakers, please do let us know, because we want to hang on their every word. So please do put your hand up. I guess it's important if you do hear the questions being asked as well. So I'll wander over here. So what I would ask is, I'm just going to ask each of you to give a quick 5-minute, couple of minutes introduction on the reports that you've led. I might just move in the direction from me to Louise at the end. So Professor Chris Mitchell, just briefly, some of the key findings from the Vision report.
Thanks so much, David. So the Vision report was one of the major policy documents first developed by the Academy, and it was really stimulated by seeing how so many groups of researchers, clinicians, policymakers worked together during the pandemic, and how working as a nation together could actually make a difference. And so the Academy working group of 14 experts, supported by roundtables, consultation, explored how can Australia better embed research and innovation in the health system to better outcomes. The aim was not to actually get more money from the NHMRC or MRFF or government. The aim was to use money better, and so that health outcomes could be improved, given the fact that more than 10% of GDP is actually spent on health. The report was published in October 2022 and included an extensive review of the literature, extensive consultation, and it ended up recommending 14 recommendations in 4 major pillars. And the long-term aim is to improve health outcome for the community, enhance health systems management, and optimise the economic benefits of innovation. The 4 major pillars were recognising that we need a skilled and enabled workforce, particularly focusing on clinician scientists, that we needed targeted and more coordinated funding for research by linking the NHMRC and MRFF more conspicuously together, and that we need a mechanism for a more significant mechanism for consumer and community involvement. And also the final pillar was integrated teams, in particular cross-sector collaboration and the academic translational health science centres. The report was released in 2021, and the Academy has been working since the report was released by working with state and federal policymakers. It's made submissions to the NHMRC and MRFF, in particular with respect to Minister Butler's plan to have better coordination between the two funding bodies. And it's also met with both state and federal ministers for health and health departments. And the Academy is going to look at progress in 2024 in terms of achieving outcomes, which will be interesting to see if there's been any impact at all.
Fantastic work. So thank you very much. And we'll come back and unpack some of these issues a little later. Don, if I could just come to you about the prevention roundtable.
Sure. Well, firstly, I should say I was really delighted that the Academy identified prevention as one of its priorities for this programme. It was very timely. We met just a few months ago, timely in the sense that Australia has a national preventive health strategy. It was developed by the last government, but the current government have adopted it and are taking some action, rather slowly in my view, but are taking some actions to implement some parts of it. It's also very timely in the sense that we have a live conversation going on nationally about the creation of a Centre for Disease Control. And it's a very strong view of almost everybody present at that meeting that this should be a Centres for Disease Control and Prevention, very similar to the US model, and that we should not miss the opportunity to do that. It was also timely in the sense that a long-term investment made by a range of investors, including the NHMRC, the MRFF and the Australian government in the Australian Prevention Partnership Centre, had reached a particular milestone, and we were able to reflect on some of the learning that has come from the research that they've supported over the past 7 or 8 years. So timing was really excellent. We were able to bring together over 20 experts from across multiple disciplines. And I was really pleased to say that once invited, we had good representation both from the Department of Health and the Department of Industry, Science and Resources at the meeting. So they were interested to hear what the Academy had to say on these issues, or they were keeping an eye on us. I'm not quite sure which. First thing I'd have to say, and we spent a bit of time on this, is that I won't quite say we're building on the shoulders of giants, but honestly, Australia has a pretty impressive long-term track record in prevention and in providing international leadership in prevention. There are some areas that I think are well known to many in tobacco control, the work Australia did in HIV prevention, the work it's done on sun protection, and we just heard from Maree the international leadership that we provided in relation to preventing sudden infant deaths. So really great foundational work there. I'd also want to acknowledge the fact that Australia has and continues to provide thought leadership in understanding some of the more complex underlying social, economic and environmental determinants of health that are such drivers of inequities in our population. And we heard from two giants of the Academy, Fran Baum and Sharon Friel, on that this morning. And again, we've a lot to be proud of in Australia in the leadership that we've provided here. Given it was an Academy meeting, we were particularly interested in appraising the state of the science, but very quickly got on to a discussion about widely held perception that there's a gap between what we know to be effective and useful and what's actually being systematically implemented in Australia. There are, real highlights in what's been done and continues to be done, but nothing that looks systematic to us or sustainable in that regard. And in particular, two areas I think we looked at. One was the potential for much more systematic approach to prevention through primary care in our healthcare system. And the other was really lamenting a failure to address health inequities through sustained, coordinated whole-of-government responses. Again, some real highlights to point to, but nothing that looked national and sustained across that. Where we got to, I suppose, at the end of our discussions And one of the things about being asked to speak briefly is that I get the chance to choose the things I concentrate on. So this is what I heard, but there will be a more comprehensive report that's balanced and accurate coming out of this. But the two things I think I would want to emphasize is where I started. First of all, we should not miss the opportunity to create a Centres for Disease Control and Prevention, and the Academy should use every opportunity it has to influence that decision and to make sure that the basis is put in place for that centre to do more than manage infectious disease outbreaks, which is sort of how it can be conceived of at the moment. And we have an important role, I think, in trying to stimulate discussion around that. Secondly, there was a sense of frustration based on long-term experience of those present that our research funding system, and I'm going to choose the language here, it won't be in the report like this, it does reward a rather regressive approach to prevention. What we do is answer really well small parts of a very complex problem, because that's the way in which our funding system is established. In my own language, we provide perfect answers to the wrong questions. And I think we've got to engage in a positive dialogue with our major research funding agencies as an academy, both about the type, and the government, of course, about what gets funded, the type of questions that we try to answer through research on prevention, and what are the best methodologies for doing this when we're trying to address complex, multifaceted problems over a period of time. So there is a real challenge, I think, around the research agenda. As I said, the Academy will produce a proper report that's both accurate and balanced, but I've got the opportunity to say what I thought was important from the meeting. Thank you.
Well, thank you for your inaccurate and unbalanced account, and we look forward to the final report from the Secretariat. Maree Teesson, could we address mental health, please?
And yes, you've got me. Yay. Thanks. And look, thanks for the opportunity. And go, you guys, for still being here, like a day and a half in, 2.5 days for those of us who are at mentoring. So clearly got the people who care about making change to the world in the room. So yay. Look, I was really delighted to be asked to chair the mental health roundtable. And the reason I was really delighted is because in mental health, we're just seen as completely fractured and arguing against each other all the time. And it was and everyone's nodding in the room, which is making me really not feel very good. But it really, the most amazing thing about chairing that roundtable was bringing together 18 people, incredible diverse voices in the room, fellows, young people with lived experience, business, industry. That just would not have been possible without the Academy bringing that together. And we were actually able to bring together a fairly coherent and agreed set of ways forward for mental health. And we produced a report, and it was published on Tuesday for World Mental Health Day. So that in itself, just that process is incredible, because the more we do that, more we'll get some consistency, even if we don't land it perfectly right every time. Now, why is that? That's clearly important to Australia, but it's not just important to Australia, it's important globally. So last week I was in Boston, and from Boston I caught the train over to Brown University, and Wellcome Trust were running, led by 2 fellows of the Academy, a meeting on the global prevention of depression. And we were asked by the Dean at Brown whether he could have 5 or 10 minutes at the beginning of the meeting. Now, he's an American Indian pediatrician, general physician, sorry, Louise, general physician. I know, I don't. And he is Professor Ashish Jai. He's the White House COVID Response Coordinator, 2022 to 2023. Like, why the heck does he want to come to a meeting on the global prevention of depression? But he just wanted 10 or 15 minutes. So I thought, well, this will be interesting. So he spoke about the incredible work that he'd done advising Biden, how important that was, what he'd learnt from doing the work around COVID. But he told a little anecdote. At the end of his 2023 role as Biden's advisor, he was asked to the White House. He went there with his family, and he thought, I know what I'm going to do. I'm going to ask Biden, what is the main public health issue? So clearly not what is the main issue facing the president at the moment, because there will be quite a few of those issues. But what is the main public health issue that you're concerned about? And what keeps you awake at night? And Biden turned to him and said, I really want to try and understand what I can do about the mental health crisis in young Americans. And he wanted to come and have that conversation with us. So for me, it was incredibly timely that we had this report, because I could quite confidently then shove across the table to this advisor, who wasn't also, he really was desperate to hear that it was infectious diseases. He didn't want to hear that it was mental health, but he knew he had to come up with some solutions. So I was really pleased to have this report from the Academy to put across the table. I'm not going to tell you about the terrible statistics in mental health. You know them. I think our really big challenge is to start to work out where we take some action, because for our political leaders at the moment, there's just so much to do in this space. They are paralysed by what do we do first? And that is an incredible role of the Academy, for us to be brave and talk to them about what do we do first. So have a read of the report and see what we said.
It's wonderful that you've indirectly got the ear of the White House, so well done. So our incoming president, if you would just give a bit of a vision of where you think the Academy's going.
Hello, folk. Great to have this great group of people here together. I'm going to perhaps just clarify some of the things I may have said last night. Look, what I meant to say. Just want to... we have a big vision as an academy, better health for Australia and the world, driven by the best health and medical science. And so we do have this big vision, but what we want to do over these next 3 years, what am I thinking of? And, you know, I think we were being challenged about, this is a really important time for our country. So we have an opportunity over the next few years as an academy, 3, 5, etc. years, to actually really make a decision about the direction that we want to further go on. We've had such a great foundation already established for the academy, but my goodness, what lies ahead. And we've just heard some of the health challenges that we have here. So one of our really important goals is to support Aboriginal and Torres Strait Islander health and wellbeing, and it sits across all the other academy goals. So how will we do this? There are many, many players in this field in our country, and we don't want to be people who are interfering and not supporting and not doing things well. So how can we really engage with, support, learn from, work alongside our fellows and other Aboriginal and other health and medical research leaders who are Aboriginal and Torres Strait Islanders? Now, part of this will be through increasing representation of Aboriginal and Torres Strait Islander fellows and associate members, and that's in progress, but we need to think about perhaps even other additional pathways to support or people with whom to work. But we will definitely need additional resourcing to ensure we influence policy and strategies the right way, that we support mechanisms of mentorship or emerging health and medical research leaders. It may well not be us who's actually leading those, but we might be supporting or etc. those processes. And we need to do this very thoughtfully, and we need to do this in a way that doesn't overwhelm our Aboriginal fellows in the process. So this will be a time of learning and discussing, but I'm sure many of you will have some really good ideas and know of strategies already underway that we in the Academy can support or build upon. Now, another important area and goal of the Academy is to provide high-quality evidence-based policy advice. And you've heard about 3 of those already here, and they're all really important. But how do we ensure that this policy gets implemented? And that's a major issue here. For example, how can we ensure that the vision for the future health in Australia that Christina has outlined starts to become official policy and strategy? And how can we develop and advocate for other important policy work? So this isn't the only work, there's going to be more ahead. So we have an enormous resource called our fellows and associate members. How can we engage with you to do this work? And that's going to be something we're going to continue to work on. We're building on really great work. I'll just make a little sidebar comment. In 1997, Australia was the first country in the world to have a national obesity strategy, and it was called Acting on Australia's Weight. And as a relatively young academic and researcher, I was involved with that. It was so exciting. I was meeting all these wonderful people there. And since then, we've had actually quite a number of policies around obesity. One of my colleagues calls it, rather than acting on Australia's weight, we should have called it waiting on Australia's act. And there's an element of truth for many of our policies there. How do we get them implemented? Not just around obesity, but around all these other issues. Okay, let me go on. We have some great mentorship and career development programs run by the Academy. We've welcomed our 100th mentee, these rising star level D, level E people. Just this year, the Life as a Clinician Scientist events reached more than 1,000 people, and we've been running them for longer, so it's more people we've actually reached. But so medicine, nursing and midwifery, allied health, and how do we advocate for more? But there's other questions. How do we get more secure research training pathways? Just been reminded that we need to think particularly about primary care and how we support the growth of research in that environment, which is actually the biggest health environment in our country. Again, you, our fellows, can help us think creatively and act on those issues. Fourthly, I've spoken with various people in the lead up to becoming president, and I've become more aware of the need to further build the health academia industry interface, which is another one of our goals. So how do we have many more examples of integration and collaboration across academia, health and industry? CSL is showing us some of those strategies, and there are some other wonderful groups, but how can we support this even more in our country? I'm spending some of next week in Canberra meeting with a variety of stakeholders, again, learning about this, but I need your support, your understanding about what the issues are. So please get engaged and help us understand how we can work with you. I do think that we can do a lot of this, but only because we have this wonderful group of fellows. We have an amazing staff here, and we have state and territory chairs and groups that are actually often very active in their areas. So I want to just finish. I've been reflecting. I want to just paraphrase John F. Kennedy's inaugural speech. He said, and just make it relevant for you. Ask not what your academy can do for you. Ask what you can do for your academy. Thank you.
So we have a presidential theme from an incoming president. So thank you. I did have some questions prepared for our panelists, but the conversations have moved and we've heard an awful lot over the course of the meeting. So this is very much open to members of the audience. And if people have questions they'd like to throw now, Elizabeth, and there's a microphone coming your way.
Thanks very much. Maree gave us an example of the value of these forums and indeed the tangible value of the reports, Maree, and I was fortunate to be part of the Prevention Summit, which, Don, I think you've represented quite accurately. But what struck us were two things. One is the people that we were talking about quite often, for example, Aboriginal and Torres Strait Islander people weren't able to attend that summit at the last minute. And we know that's because many of them are so overcommitted. So we really do need to commit to communicate with them perhaps in some other way. The other thing is we were all aware of the evidence for the need for action on prevention, and we can document that. But I think these reports that come out of these forums really must be action plans so that they can perhaps be followed. And I suppose the final thought that I had, having brought this really diverse and informed group together, Don, it would be really nice for the Academy to be able to facilitate that group to get together more than once. And that might be after a first face-to-face meeting for cost reasons, that we meet by Zoom or whatever. So I'd be interested in your thoughts on that.
Right, there we go. Thank you. It's on, is it? Yeah, that's right. That's why I couldn't turn it on. Competent. So I agree, firstly, with your comment. We'd made a particular effort to ensure that we had a couple of First Nations colleagues join us for the meeting, and regrettably they were both unable to attend on the day, and that made us a bit awkwardly placed. So I do think we both have to make sure we communicate effectively the outcomes from that meeting. But if we do anything in the future, that we work out the right way of actually making that happen. Elizabeth, I think we spoke a bit about some of these issues when we met, and about what's the role of the Academy. Oddly, I'm a little bit conservative about the role of the Academy. We'd invited Terry Slevin from the Public Health Association, who's a rabid campaigner, and I sort of see Terry as the sort of go-to guy to start open advocacy, and that the role of the Academy is more about marshalling the science, highlighting the gap between what we know and what's being done, and perhaps doing some slightly more gentle advocacy, if I can put it like that. But I mean, I'd be really interested in others' views on this, but it was an issue that we discussed at the meeting, and it remains an open question, I think, for the Academy as to what kind of role it plays in relation to some of these things. With regards to continuing to talk, I think, if there's a purpose to meet, we should continue to meet. And in some respects, one next step might be to open up a dialogue with our colleagues in government who were, quite keen to attend and be a part of that discussion. And it might be that we want to pick up a discussion with them that's a bit more focused around, so what is going on and how might we contribute to that as an Academy in a way that's most appropriate. But I'll sort of defer to my friends in the Secretariat as to what's actually manageable.
So John's left a question there. So rather than leave it hanging, what are people's views on our role? I don't have a particular view, but are we advocates, or do we go further than that? Taryn, did you want to?
So just with my Public Health Association hat on, I think it's really important that we advocate collectively. I think we're getting used to doing that. So you see lots of logos on letters and stuff like that. So we're used to quickly getting together, all agreeing that we all, a consensus point of view. But I think we need to go a bit beyond that as well. And I think we need to, at points, be good followers. We don't have to all lead on everything. There are natural leaders for particular issues. And for most things, it's someone else. And for a few things, it's us, I'm talking generally here. And so if there is a natural leader, then we should allow them to kind of take the lead and then be good followers in whatever way they need us. And we've had the conversation in PHAA about how we've been pushing very hard around around the Centre for Disease Control. We, really have done a lot of work in the last 2 years, and at times we wanted to get more consultation, and we've been going to government, etc. And we've had the discussion: could the Academy help us? Given they bring something different to what we're giving, and the government is sick of us knocking on their door, how could we get some different players in? And for other things, maybe the Academy leads and PHAA or whoever follows. So the point I'm making is it's about collectives, about advocacy, but also about being very strategic about who leads and who follows.
Give that insight. Andrew, I'll come to you. Yeah. Are you responding to this question, or Sharon, were you going to respond to this particular issue of advocacy versus not? So maybe we'll go to Sharon first, and then.
I was, but and then I also have a question as well. Is that okay? I don't want to spoil the flow.
I'll jump to Andrew shortly.
Okay. And so it sort of relates to another comment that you made on of we see the perfect answer to the wrong question, and so therefore the type of evidence that we're using in our advocacy. So if we have an extensive amount of evidence associated with the wrong question, and as an academy, our legitimacy is the evidence, the research that we bring to bear, then we have a structural problem in how and what we can say that is going to really shift the dial around health equity. So I think when we ask the question of should we be advocates, using what to inform our advocacy, I'm very concerned. I would love to see the Academy really have a much wider pool of public health, social health within the Academy, so that we don't have a dominance of a particular type of prevention evidence being brought into those sorts of conversations. And then can I ask the question, because it's sort of related, or would you rather keep the conversation going? I'm very happy to.
Well, maybe I'll just get a response to that, and then
my response really, I really agree with what you just said. But I think that was the nature of the discussion we had on the day, was exactly mirroring what you've just said, is that we have to be careful not to perpetuate it. We need to create a dialogue about the nature of evidence, about the way in which decisions are made around what types of research to fund. How do we get answers to some of the more complex drivers of poor health and inequity in Australia? And we don't, at this point, have a funding system that seems to be sympathetic to that challenge, basically. So, and that's, you were more sophisticated in your analysis, but that was the nature of the discussion that we had.
I might jump to Andrew.
Can I just say one thing?
Yes,
yeah,
of course.
We had similar discussions in the mental health, but it was really dominated more by the fact that we actually did have fantastic research in this country in the mental health area, and it was bringing it together and bringing it forward. We're like 4th or 5th in the world for citations, 4th or 5th in the world for publications, answering the questions that needed to be answered. It wasn't an accident that 2 fellows were leading that meeting in Brown. So it was a little bit less pessimistic. I'm not as pessimistic about this. It was more about how to amplify that evidence. So I don't want to leave it hanging that we don't have fantastic evidence in this country. We do, to answer these big questions. And what we could do as an academy was bring that together with a diverse group of people, lived experience policymakers, to ask, well, how did that fit and how could we take that forward? So, yeah, not everything. I agree, we've got a lot more questions to ask, but we did have an incredible evidence base out of the 20 fellows who are members of the Academy and a mental health. Christina.
I have to agree with Maree. We saw in COVID that we had to generate new evidence because we didn't have the evidence, and the whole sector came together, whether it was from public health to immunology to vaccines to clinical guidelines came together to generate new evidence. But for a lot of disease inequities, we have the evidence. We know that colon cancer screening, pick a lock up blood, but only 20% of the population take it up. We have a lot of evidence, and one of the challenges is the implementation of the evidence, and secondly, the access of the community to the health workforce that's going to implement that evidence. And I see one of the big challenges that we're facing is I run a medical school, but only 20% of my students want to be general practitioners anymore. And I'm pleased to see Danielle in the audience here because, general practitioners are the face of implementation of evidence. And I think it's going to be a big challenge in terms of our workforce, that we need to get the workforce we need to enable prevention. So that's a big challenge, and that the Academy is working on workforce. But it's implementation of existing evidence as well as generating new evidence and getting access to the workforce, general practitioners, who can actually see the population to implement the evidence that we know.
And we will come back to this workforce issue shortly, so I want to tap into that idea. Been very patient.
Andrew Way from WeHi. With respect to the key issue of closing the gap, and notwithstanding the huge social issues that need to be addressed, is there any longitudinal Indigenous biobank of longitudinal samples that is available as a national resource for many of our scientists that work in the city, would love to contribute in some way but don't have access to samples or material of relevance that we could link, and with genetics and prediction and prevention, I think just going to be such a huge future opportunity. It's hard to apply that if we don't have the samples to do that research. And my question is, does such a repository exist? And if not, does the Academy have a role in perhaps maybe enticing some philanthropy to establish one?
Who on the panel would like to... Do we have any Aboriginal or Torres Strait Islander researchers here? Or...
There is a Centre for Indigenous Genomics which has been established at ANU and funded, and that is being led by Indigenous people. So
I think that the answer is, have you to connect with that group in the first instance? Is that the sort of question you're asking?
I mean, if it does exist, then maybe it needs to be publicised more widely, because I think there's many researchers which have numerous techniques which could be utilised to answer questions, generate questions, and test hypotheses. But I've never heard of its existence, and maybe making it more widely available and more known would be really helpful.
We've just parachuted in someone from the ANU who can talk.
Sorry, thanks. Sorry, I'm late to the conversation. Alex Brown, as many people know, heads up the National Centre for Indigenous Genomics. There's a joint appointment between ANU and the Telethon Kids Institute. And he is developing a national and actually an international consortium of biobankers around Indigenous genome data sets. National Centre for Indigenous Genomics has existed for a few years before Alex came into it, and has spent a lot of time building a sort of gold standard approach to data sovereignty and access and approvals and so on. In some ways, learning from ANU's history of its experience with acquisition of data and specimens in years gone by that wouldn't pass the test these days, and having to try and deal with that through appropriate reparative measures. And I think that's been a learning exercise and a cathartic exercise for the university, and has helped the National Centre for Indigenous Genomics actually be something that we're now very proud of the way it operates, and it's become sort of a gold standard for international Indigenous data sets.
Your entrance timing was perfect. Sharon, did you want to ask your second question of the panel? Or were there other questions? Or no, otherwise, Sharon, and then I've got follow-up questions for our panel.
Okay. Thank you. So it was a question really for you, Louise. You were talking as one of the things, you know, for us to work towards strengthening between the academy and industry. And so my question is sort of, for what purpose? If our sort of our discussion and our discussion around the types of evidence that we generate within the academy, there's a whole field of work, a field of research that examines the role of conflicts of interest and of terms of engagement and what that means for both in terms of research direction, research agenda, but then of course feeding through into policy and practice. So a question, yeah, just for what purpose?
I was sitting next to Ian Fraser last night, and we were discussing the issue that when the next pandemic arrives, not if, but when it arrives, how well prepared will Australia be to react quickly and well to develop a vaccine against a disease that may be more virulent than COVID was? And will we need to rely on access to vaccinations that occurred off-site around the world but weren't actually developed where we didn't have safety? We didn't have that, what's the word I'm thinking of, where we could actually vaccinate Australians or people in the immediate region first, rather than waiting for people around the rest of the world to be vaccinated. That was an example of one of the reasons why we need to ensure that we have a strong industry around vaccines, pharma, other technology in Australia, and rather than being a country where we're dependent upon other countries to allow us to have their largesse, rather than to be one where we can have that role. And I think that's really important. And of course, being Ian, it was in the context of another significant illness, another infectious disease that will come, pointing out that they're getting more frequent. Some are very virulent, others much less so. COVID was an example that should be a wake-up call, not that we'll have the next one in 100 years. The next one will become more quickly. So that's in the context of infectious disease and being able to protect our, not only Australians, but our community around us. But also having industry like that helps build other benefits. We'll have other help, other things that will happen as a result. I think it's important that we need to manage this well. We have fellows who work within various industries. I'll just take a sidebar. I actually work in the health industry, known as New South Wales Health. I'm at the university, but I'm part of New South Wales Health. And perhaps one of the reasons that some of our things work and get implemented quickly is because people like me are actually in the health system working to change health services. That's my industry that I work in, but we're actually thinking of broader industries as well. So I don't think, but we need to manage those relationships well. It's really important that we have fellows who understand the health system, but who actually understand industry, who understand what it takes to go from initial discovery science into actually implementing and bringing out products that will actually help people's health and well-being in our country and elsewhere. We need to have those conversations. We need to manage those conflicts of interest well, but we've got guidelines to do that. And we can actually make ourselves, and we can hold people to account around that. But it is really important that we have dialogue around those issues. I'm sure others could answer this better, but I don't want to see us having problems in the future. I want to see groups like CSL, but more of them. I want to see us not to have to wait further down the line in Australia before we get vaccines that work in our country, before they come into our country, those sorts of things. And there'll be many, many other examples. I'm sure some others would like to comment.
I've seen that Catherine Luckin has her hand waving in the air.
It's probably Yeah, she'll probably actually tell us exactly what the issues. I've got it all wrong at this stage. It is part of our strategy, I might add, our 5-year strategy.
Yeah, I just wanted to sort of offer some reflections, I suppose, from the Secretariat on the conversation, which has been extremely useful. And this is why these meetings are so valuable, because it gives us a real chance to hear from people and what they make of what we do, what they'd like to see us do more of, and so on. And I'd just like to record my thanks to the people at the front for leading these projects. We email and ask, and they always say yes. And it really means a lot to us to work with you all. There were 2 particular comments that I want to just follow up on in terms of our policy work. One, that they're sort of connected as well. So the first is that we really do strive to make those policy reports actions focused and make them into action plans. And I think particularly with the vision, that was a real focus. You know, we went as far as outlining the recommendations and identifying priorities in each case, and those are the ones that we're really pushing. And the reason that we do that is so that we can then follow up those reports to make sure that they have meaning and impact. And the biggest challenge that we face, I suppose, in our policy work, and this is something that comes up with our policy advice committee frequently, which Don sits on and others, and Paul Scuffham chairs, is how do we balance taking on new projects, as there are so many pressing issues and we have obviously a wide range of expertise and we really want to engage everyone. How do we take up new projects while also allowing enough time to do that follow-up work and make sure that these activities have meaning and impact? So it is a question we're constantly asking ourselves, and I'm always grateful to receive feedback on how you think we're doing in that regard. But I just wanted to provide some assurance that that is a constant ongoing conversation and a real area of deep thought for our policy team, which is 2 people, currently only 1, but we're recruiting a policy officer, but our head of policy, Lanika, who's unfortunately not here, but really does do an immensely fantastic job. And that's as well as responding to all of the consultations, of which there have been 12 over the last 12 months, I'd like to point out. So I just wanted to sort of put that into the conversation and just provide, I suppose, a bit of insight into the process that we follow, and hopefully that's sort of helpful and you can kind of see how we're working. And we may not always get it right, but we're always keen to hear how you're sort of interpreting what we do and reflecting on what we do. So thanks.
Thank you for that realistic appraisal of our capabilities. So thank you. Don, would you like to offer a comment?
Yes. So first of all, I'd just like to say how much all of us who work with Catherine and Lanika appreciate the extraordinary work that they put into the functioning of the Academy. It was more, and I realise we're going to run out of time because it's a fascinating discussion. I wanted to pick up on the issue of the relationship with industry, because there's sort of industry and there's industry. So I think we heard a bit this morning, particularly from Fran and from Michael Marmot, about the commercial, I think mainly from Fran actually, about the commercial determinants of health. And about the importance of us understanding how commercial decisions and commercial activity has an impact on health overall, and particularly has a differential impact on health, with often the most vulnerable in society being the most vulnerable to commercial activity, and a separate but not unrelated but separate nonetheless debate about Australia's inability to capitalise on its outstanding performance in the basic sciences and discovery research. And there was some very tucked away in the recent review of higher education in Australia. There was some very telling statistics. I won't get them right, but it was something like Australia is certainly in the top 10 among the OECD countries in its performance in basic discovery research. But is ranked about 34th out of 35 in its ability to convert that into innovation in the economy. And I think my sense is the Academy is quite interested in ensuring that the tremendous advantage we have in basic and discovery research is converted into things that benefit society. And is also interested in ensuring that the unmanaged commercial activity, which has such a detrimental effect on health, is exposed. and addressed. There is an overlap, but they are two separate sort of issues, it seems to me, that the Academy has a role in both.
Thank you for those words. Now, I've just looked at my watch and I realise we are absolutely out of time. So I've done a terrible job of chairing, but it's such a fascinating group of people we have on our panel. And I really appreciate the questions from the floor as well. And I'm sure those of you who can stick around will stick around for lunch and continue to chew our ear. I will give you the grace of maybe a 30-second summary. If there was any particular message that you would like to impart that should have been said that wasn't said, you have the right to speak.
I guess I just would like to commend everything Ingrid and Louise have done about our workforce and life as clinician scientist and mentoring. We do have a problem with workforce in a sense that it's patchy, it's funded by the Commonwealth and the state, and we've got a maldistribution of workforce. And I think that these are the challenges for the future for us, and then we as an academy should be setting out a clear plan, as we hope we did in the Vision Project, to how some of these issues could be addressed.
We had a lot of things we were going to talk about. That was one of them, and I'm sorry that we didn't get time. Yeah.
I will reiterate the workforce issue. I think really, really important that we keep that at the forefront. And the mentoring, and I can see some here of our mentees, they're the future. So, yeah.
That's a very nice, positive way to finish our panel. So can you please join with me in thanking Professor Christina, John Nutbeam, Maree Teesson and Louise Baur. Thank you.